All right, Kentucky, it is 5 o'clock. Same time we get together every single day. Recommit ourselves to fighting this coronavirus and make sure that we all know that we will get through this and we will get through it together. So say it with me like we do every single day. We will get through this. We will get through this together. And one more time, we will get through this. We will get through this together. We are going to get through this because from the very start, we have been committed, we have been united, and we've been willing to do what it takes to defeat this coronavirus. We have remained calm. We have accepted the very strange reality that we face. And you have made the sacrifices that it is taking to protect people around us. Remember, even with those sacrifices, we are going to have escalating cases before we have fewer cases. In other words, we still know across the country and here in Kentucky that it is going to get tougher before it gets better, but we are not talking about an indefinite period of time. We know that there is an end. We just have to be strong enough to get there, and we have to be resilient enough to get there. I absolutely know that we can do it, and the way we do it is by following the 10 steps that we talk about in battling this coronavirus. Number one is the most important. Be healthy at home. All of us should be at home, not just at 5 when we're talking, but we ought to be at home as much of the day as we possibly can be. There's really only 3 things that we ought to be doing outside of home. Number 1 is going to work if we're going to work. Number 2 is getting supplies if we need them. And number 3 is getting exercise. But making sure that exercise or supplies are not an excuse to violate, the healthy at-home steps that we need to be taking. The more you are healthy at home, the more you are doing your duty as a member of this Commonwealth and as a patriotic American, and the more people whose lives you are saving. The more you are at home, the more lives that you are saving. I know that's kind of hard for us to grasp. It's one of those questions of what do you mean if I just stay at home and don't get out? We protect people's lives. You do. We never know what we're going to be called upon to do that will ultimately help save people's lives. Here, it is staying at home. So please do it. Number 2 is avoid crowds and gatherings. No exceptions. No matter what, every crowd and gathering is how the coronavirus spreads, and every crowd and gathering increases our potential death count. Avoid them all. If you're planning on going somewhere and there is that crowd, don't go there. And this is of any size. Remember, and we've been talking about this lately, house parties we can't do. Even family gatherings this weekend, even if you plan to stay 6 feet apart, we can't do. Those are the types of things that will increase our number of cases, will hurt us in our ability to flatten the curve. This is the time where we have to be the very best. And we couldn't choose the time that it's happening, but we can choose how we respond to the calling that we have. Number 3 is practicing social distancing. That's that 6 feet apart. Remember, 6 feet is not an excuse to get together and to be together 6 feet apart. That is what we need to be apart when we are in the grocery store or when we're exercising and come upon somebody else. Any socializing that we're doing 6 feet apart, do FaceTime, do Zoom, do another method of doing it. It's going to help protect people's lives. 4, know when to seek care. It's going to become more and more and more important. This is what makes sure we have a bed, an ICU, a ventilator for everybody who needs it. If you are healthy but nervous, call the hotline. If you are sick but wouldn't have otherwise sought care, call, but do not go to your primary care physician. But then, if you really need help, make sure you get it. If you are sick, get care. Don't not get care if you are really sick because of the coronavirus. There are other things out there, obviously, that harm us as well. Or if you are injured, make sure you get help for your injury. kycovid19.ky.gov, the #1 source that has true information, helps you dispel the rumors. Wash your hands, 20 seconds, no cheating. Remember, soap and water is better than any type of hand sanitizer. and make sure your disinfecting services, you can use a 1-100 bleach solution or anything that you can purchase. Apply for benefits. We talked about this yesterday. We'll probably give another update tomorrow. I know that there is anxiety out there and it's taking too long to get back to you. But this is the largest request we've had, I believe, in our history. And we are doing everything we can to keep up with it and to make sure we have folks that can help you get what you need to get through it. Also, make sure you sign up for Medicaid. That not only helps you have coverage, it's going to help with our healthcare capacity. Prioritize your mental health. This is hard. It's hard on all of us. It's hard on me. I know it's hard on you. Do the things you need to take care of yourself and ask other people, showing that kindness and compassion, how they're doing. Make sure that's one of the first questions that you ask people through FaceTime or Zoom or over the phone. Do not travel. I know we've talked a lot about going to other states. Don't travel anywhere that you don't have to for any one of those very small exceptions. Be healthy at home. And finally, report your non-compliance. There are always 10 steps, and then there's the 11th. Please fill out your census. We're going to show you a slide that's about a day old, and we are doing well compared to other states, but I've never been all that excited about being 10th or 11th or 12th in the country at something. We can be number one at this if we also view it as our duty. And then we've asked that you all just show the rest of the world and the rest of Kentucky what an amazing job that almost everybody is doing in Kentucky. Now, with this being hard on us mentally, with this being hard on us emotionally, with us being separated physically from each other, we've asked you to use social media, which before this we would have said is interconnected. It connects us in so many ways. I think now we realize how much we miss that physical connection, but to fill up social media with as many examples of your good work as possible. I will tell you, this is, and we use these hashtags, this is one of my favorite things to do every day. It reminds me that we are in this together. It reminds me that we are not alone. And it is so special to see you and your kids and your family and your organizations doing so many good things. And I know we're just sharing a tiny fraction of them, and we're proud of each and every one of them. But we're going to continue to do this every day because this is what we need to see out of Kentucky. All right, this one really hit me today. This is Elizabeth Banks talking about her husband, who is a doctor, who is walking into harm's way every single day. And what she is asking is that people stay home. The number one thing you can do to help your healthcare providers is to stay home. And I also liked how he looks about 10 years younger after he shaved that beard. Let's go to the next one. All right, these are, again, folks that are out there providing for meals, NTI, that's non-traditional instruction, the things that our kids need. It's very important that our kids are busy, are on a schedule, have intellectually challenging schoolwork, and are well fed. But there is a reason that I like this picture and I'm showing it. And I bet everybody else out there can guess. It's that they are socially distanced. All too often, when people are doing these really great things and we get a picture, they're all together too close together. And so let's remember, even when we're doing the right thing, even when we're feeding people, even when we're EMS and police and firefighters, every moment that we don't have to be close, we need to be separated because we want to make sure that if somebody contracts this virus, it's not spread amongst the other people that are there. We care about you, and we also need you. We also need you, and so every chance that we can cut down on the number of people that it might be spread to, even in kind of the same unit that's working together, we need to take advantage of. I continue to love this chalk art, almost Renaissance, that we're seeing all over Kentucky. And what we are seeing is we are artistic people. I mean, really incredible work that's out there. But I will tell you, when other people walk by, this lifts their spirits. And in a time when anxiety is where it is and our spirits might be down, I think this is more powerful than we are giving it credit for. Because when you make it, it's there for everybody. And you know it's not permanent. You're doing it not for yourself, but for other people. So I'd say keep it up. In all of these areas, keep it up. Oh, this is the donation of concessions and toilet paper. I know that's hard to come by some places, to Ronald McDonald's house. And the thing I love about this one, this is a facility that can't be open right now. And they could be upset about that, but instead, they're making the sacrifice and they're trying to do good things with the extra supplies they have. So thank you for that. All right, this is another opportunity of folks to try to help their community, Henderson County Schools, trying to make sure that people stay intellectually engaged. And here we've got, again, not just an individual, but a family unit. Right now, being in our family units more than ever, trying to do what they can to improve the spirits and to do everything that we can to lift each other up. This is from the Pikeville Medical Center. They're treating COVID patients today, just like they were yesterday. This is their staff that is here for us. Let's make sure that we stay home for them. It's National Public Health Week, and we want to thank all of our healthcare providers. We want to thank our departments of public health. You all are special people. And I tell you what, we should have all known it, but the whole Commonwealth knows it now. All right, now we got, I'll let the video speak for itself. It's a special one.
Dear healthcare workers, we want to thank you
for dedicating your lives to taking care of others.
We know that whenever you chose this career path,
you probably never imagined
that you would find yourselves in the situation we are in today.
The pandemic we are facing was not of your making.
But yet, there you are, standing on the front lines,
ready to do whatever it takes to save lives. Your efforts are not going unnoticed.
We see the sacrifices you are making.
We see how you're trying to protect both your patients and your families.
we know that you are mentally and physically exhausted.
Please remember, there is hope.
As our governor reminds us every day at 5.
We will get through this.
We will get through this together.
Words can't begin to express how much we appreciate all that you are going through
to protect us.
We would just like to say thank you.
Thank you for all that you do.
Thank you for your dedication.
Thank you for your compassion.
Thank you for your devotion.
Thank you for your sacrifice.
Thank you for taking care of others.
May God bless you and continue to keep you safe.
We appreciate those Floyd County students saying what we've been trying to say, but doing it so much better. Thank you to everybody out there on the front lines and your courage without enough PPE, knowing that you can or you will get the coronavirus for treating other people that have it. Thank you. And because of you, we are in such a better place than we would have been without you. Let's talk a little bit about where we are. We are certainly in our escalation, in our surge, though we know the days coming will get tougher. While nationally they're talking about this week and next week being the very tough weeks that our nation is going to face, we know our cases are escalating. Now we think we're doing it slower, and that may mean a little bit longer than others, but that is exactly how we save lives. I want to go back to one we haven't shown in a little while, and that is Philadelphia, St. Louis, and Louisville, because right now what we're hearing about And there's been a whole lot of national attention in the last couple days, and I think it's because we need some optimism, but I know we're resilient, because we've heard a lot about when we're going to hit a peak, and then a lot of questions already about, well, when can we stop making the sacrifices that we're making? We haven't had direct evidence of a peak at the moment anywhere in the United States yet. They think they might be getting it in New York, but I want to see that data because we have got to be strong. Now, New York had a significant escalation, not like this, because they did engage in more steps and they did faster than I think Philadelphia did during the Spanish flu pandemic. But if there is an area of the country that has truly been hit in a severe escalation, it's New York, followed by some others. So let's show St. Louis. So again, here is we've always used this as the example of the difference in taking aggressive action, which we did, and social distancing, which we have. But the reason I wanted to show this again today is, with some of the stories and the attention and having, more questions than we ever have about, we're hearing in some other places that we might have a peak. What date? By what date do you think we can relax things? Remember, when we don't do this right, and when we don't stay strong and resilient, we can have a worse peak at a later point in time. So we haven't shown this in a while, but it shows that if you do not stick with this, if you are not strong enough, that you actually can lose more people by not being resilient. So what I'd ask for people is stay with us. What you are doing is absolutely working. And then let's just show Louisville. I know that in that first peak, we are much more like St. Louis than we were Louisville in the Spanish flu, because we have the numbers that show we are doing better than just about anybody in the United States. But what we got to make sure is that we do this right, that we protect our people, and that we know that some of this early optimism was Japan had too, and now they're back down. They're back in a very difficult situation. So I just want to make sure that we are committed, that we are ready, that we are willing to make the sacrifice to beat this coronavirus on the very first try. Our goal is to be like St. Louis in the first piece and more like Louisville in the second piece, because our goal, with the knowledge we have and your amazing commitment that we have seen and that we can prove right now through the numbers, we want to be the very best we can be and protect the maximum number of people. All right, want to go into a couple of next steps that we are taking. First, we have a new executive order today, and I'm going to ask my Chief of Staff, Latasha Buckner, to discuss it. It deals with one new retail restriction. It deals with, I can't believe that we had to put this in an order, but there can't be any door-to-door solicitations going on right now. I mean, that's the honeybee model that spreads it. And last, that we're going to renew our ability to get a 30-day refill on a prescription without having to go see doctors. So, Latasha Buckner. I didn't say it all.
Thank you, Governor. So we just issued a new executive order. It does two things. The first thing that it does is it does limit in-store to the life-sustaining businesses that we've left open to one person per household. And this helps us a lot of ways. First of all, it's going to help you and the business practice better social distancing if there are less people in there. It's also going to help your family stay safer because you have less people going into the stores and potentially becoming exposed. It's going to help you stay safer and the employees of the business. The order applies to all of these still life-sustaining businesses like grocery stores, pharmacies, hardware stores. It also means that families and households shouldn't go to the store together, but instead one adult gets what's needed while the other members stay healthy at home. So going to get groceries shouldn't turn into a default date night because we're all wanting to get out of the house a little bit. Now there are exceptions, and those exceptions will be for the people who can't remain healthy at home without your care or supervision. So if you're the adult in the household and you need to go out and get groceries, but you have minor children or other adults who have physical or mental impairments where they can't be on their own, they can still accompany you to the grocery store or the pharmacy. We're also asking that these businesses who are fortunate enough to stay open still use common sense and good judgment in helping us enforce this order. Second thing is just what the governor's already discussed, the honeybee problem. If there are people still going door to door to all the households to either sell magazines, fundraise, drum up business, it's creating the problem that we're trying to stop. Furthermore, it prevents you from staying healthy at home if people are deploying honeybees everywhere. And then, as you said, we're doing a re-up of the pharmacy order that allows pharmacists to employ telehealth and renew your prescription. Thank you.
Thank you. So for everybody out there that's, take something normally, and like I do, whether it's, I'd take a prescription Singular, that allows you to get that 30-day prescription, and now this will let another 30-day prescription without going in to see your doctor if you have the no refills. This is just a way to keep everybody healthy and to make sure that that we're getting everybody what they need without exposing them unnecessarily to the coronavirus. Number 2, and if I can ask somebody to grab the mask that our folks are making from my office. I didn't bring that out. Number 2, just I've thanked a number of different people that are doing important work at this time. I know that there's a lot of expansion going on out there in healthcare facilities or conversion. I want to thank our construction workers that are helping with that know we've got to increase our capacity and are doing what it takes to do that. Update on the field hospital that we are working to put together on the fairgrounds. We've ordered the beds. We're working the plan. Our hope is to have 250 active beds if needed in about 2 weeks and to be able to scale up from there. And just generally, we've been asked about different steps that we would like to see to make sure we can take care of people. That is our primary facilities that right now are getting folks in. Once they reach a certain capacity, we want to make sure we're also pushing folks out to the good facilities all over the state, making sure if there are hospital beds that are out there, especially when we are under that capacity, when they are needed, that they are being used, and making sure that we take advantage of all of the great providers that we have out there as we see those numbers coming up. And it'll only be when across the state we see a certain capacity hitting all of our potential beds, that's when we turn on the solutions like the fairgrounds or others. That we know that there are already great providers out there. There are good hospital beds and facilities, and we want to make sure that we are using those before we have to resort to other means. And that's, again, how we're all in it together, that a community hospital that may not have enough, that doesn't have significant numbers of people in it from their own community can help out others. All right, we mentioned the other day that we have our prisons that are helping to manufacture masks. Here is one that they are doing. The very first use of it is going to be for them. We want to make sure that people can be as protected as they can. And listen, our folks that are currently incarcerated made these, and we want to make sure that they get the pride out of that, but also the protection. But these are also going to be going out to state employees and others across Kentucky. Again, wearing a mask in public, which the CDC now says that people can or should do, is more about in case you are asymptomatic, not spreading it to other people than any other use. And remember, just because you have one of these on doesn't mean you can be next to somebody violating that 6 feet. Doesn't mean that you can get together, even if you're 6 feet apart. Healthy at home is still the requirement, followed by social distancing. All right, I just got handed this, and this is great news for so many people out there. We just received access to the additional $600 payment for unemployment from the federal government. And we have confirmed that we'll start payments tomorrow evening. That's pretty exciting. That's come in since we started. I appreciate that legislation passed by the federal government and signed into law by the president. That's really going to help our people, especially since so many of them only get a certain percentage of what their income would otherwise be. This is going to be a significant help. We are activating our first state park, though on a somewhat small level as we work up to it. It's going to be Kentucky Dam Village, and I want Dr. Stack to talk about the first folks that are going to be staying there as they are helping other people.
Thank you, Governor. So it feels like forever ago, but a number of weeks ago, I put out a call for volunteers, and we have over 700 students in medical school, nursing school, pharmacy school, and other healthcare professionals and other non-healthcare professional schools who have identified themselves in our database as volunteers. And we have a facility who's in need of help, where they have a number of individuals who've become infected with the coronavirus. And so we have called up the first cohort of volunteers. Now, I've asked them all, and they've given me permission to mention them by name. So we are calling up Gant Unfried, Meredith Dowdy, Amanda Meyer, and Heather McGuire. And they come from both University of Kentucky and Kentucky College of Medicine. They're third-year medical students, all four of them, and they are going to be deployed tomorrow. And so they will be out in the field helping the community. When we informed the community that they would have this help, I'm informed that the local community was very grateful and described them as angels coming to help. And so I cannot begin to express my gratitude enough on behalf of myself and the governor for their volunteerism and being willing to go help others in their time of need. For all the other volunteers, check your email tonight. I'm doing a webinar with you tomorrow, and I need to talk about this because everyone who volunteered, I need to have you on standby. We may be needing to use you as we go forward, and I'm going to go into some details about that. So thank you very much to these medical students, and we look forward to the great help that they're going to bring to that community. So thank you, Governor.
Thank you. Well, and when Kentuckians were asked to answer the call, look at how we've done it in so many ways, including our medical students volunteering to put themselves in harm's way because this is what they signed up for, and wanting to make sure that they were helping their fellow human being. Next point, mass gatherings this weekend, we can't have any. We are right in the crunch time for us making sure that we flatten the curve and that we save people's lives. This is a tough week for that to be our reality, but it is our reality. Whether we're of the Jewish faith and its Passover or the Christian faith and its Holy Week, I know that's asking a lot of us. But let me thank just about everybody out there, the 99.9% that not only are willing to, but have stepped up and are willing to sacrifice how this week would normally go. My faith compels me to protect the people around me, to treat my neighbor as myself, or maybe I'm treating my neighbor like they're members of my family and trying to do everything I can to protect them. While I know it will be hard to worship virtually or in other ways, it will save lives, and it'll mean the people that you normally see in person at church will still be in church months from now. It protects your congregations. It protects people around you. It's our test of humanity, and maybe it's even a test of faith to be able to do things differently. But knowing that our faith is strong, that we are up for this, and that we are protecting our fellow human being. But for all those kids that are watching out there, we've received this question. We have had different travel bans, and one of the exceptions on there is work. So I want people to know that the Easter Bunny is an essential worker and that the travel ban does not apply. So those that have been worried about whether the Easter Bunny is going to make it for them this year, I can tell you that that is most certainly an essential worker, and falls in with the exceptions of our travel ban. I know my kids who are watching will be really happy to hear that, and I hope yours are too. All right, let's go over our numbers today, and this is one of the times where, well, we got to breathe and know that everything we've talked about expecting, is just what's happening. We are in our escalation. We talked about the last 3 days being good on the averages, but not making sure that we draw any further conclusions from it. Today, we have our largest number of total new cases that we have had, which is 204 new cases. That brings our official total from the state, up to 1,346. We have new cases, and remember, when things are reported at different times lead to different numbers by the day, but typically they come together within a 24-hour period. We have 21 new cases from Davis, 19 from Fayette, 19 from Hopkins, 17 from Kenton, 15 from Jefferson, 14 from Campbell, 11 from Pulaski, 5 from Muhlenberg, 3 from Hardin, Henderson, Jackson, McCracken, 2 from Adair, Boone, Graves, Jessamine, Laurel, Madison, Marshall, Ohio, and Oldham, Rockcastle, Russell, Shelby, and Warren, and 1 from Ballard, Bullitt, Butler, Caldwell, Clark, Crittenden, Franklin, Grant, Hancock, Harrison, Hart, Henry, Logan, Marion, Mason, McCreary, McLean, Nelson, Pendleton, Scott, Taylor, Todd, Union, Washington, Whitley, and Woodford. And then we have some that are unconfirmed. Again, it's everywhere. And that's all that this is saying. If you've heard the first one in your county, and I can pick out a couple here that I think are, it's been there before now. This is just the first confirmed case. That's why all of us have been practicing social distancing, I hope, regardless of where we are. So can you go back to the Philadelphia, St. Louis? Remember, even when we're doing this right, even when we are doing it right, which we are, there is still that escalation. Even though I think we are more like St. Louis than the rest, we have still not reached, that first peak. And that's why we're going to see our cases continue to increase. Now, of this number, we have had 339 people that have fully recovered. Right now, we believe we have 205 people hospitalized, and these are at least numbers. This is what we can confirm. And 93 people that are in ICUs. Our other news today, again, it's hard every time, is that we believe we have 8 new deaths here in Kentucky. And they break down in county by a 63-year-old male in Jefferson, a 90-year-old female in Jefferson, 91-year-old female in Jefferson, 93-year-old female in Jefferson, 78-year-old male in Callaway, 76-year-old male in Christian, 86-year-old female in Christian, and an 86-year-old male in Christian. Now, these are 8 Kentuckians that we have lost, and it's a loss for all of us. It's a loss for those families. It's a loss for those communities and their friends. So let's light our houses and our places of business and our institutions up green tonight. Green's the color of compassion. It's also the color of renewal as their spirit moves from their body to a better place. Let's light it up more green lights than we've had any night thus far. As we continue to lose Kentuckians, let's continue to come together. Let's continue to make sure that people know that they are not alone. I want when people look out their windows in and around their neighborhood for them to see green lights. And tomorrow, 10 a.m., ring your bells, whether they're church bells, whether they're bells that you have that you can step outside with. In the governor's office every day, one of our folks walks outside in that rotunda and rings a bell that they have brought to work. Now, our breakdown, which we are trying to provide on on race, we currently have on, when it comes to all cases, we know the race of 66% of the cases. And so the numbers I'm going to give you are within that 66%. They are 80% Caucasian, 11.76% African American, 3.5% other race, 2.5% Asian, 2.28 multiracial. Of our deaths, where we know, we believe we have about 82% of those total, and the breakdown is 86% Caucasian, just a little over 12% African American, about 1.75% Asian. So those are the numbers where they are right now. But every single one of the folks that we have lost, let's remember, they were very special people, all of them. Want to mention one today, as we've tried to put a face on individuals we've lost, and that is William Miranda. So William Miranda is from Boyd County. He was 96 years old. He died over the weekend from complications from the coronavirus within days of testing positive. He was on Omaha Beach on D-Day. When we talk about that greatest generation that made sacrifices, that one that in this specific time we look up to and know that we can do this because they did, he's one of those very brave souls. He was injured on D-Day. He was later awarded not one, but 2 Bronze Stars for his service. His son Richard says, "He was my hero. I was very proud of him." And Richard wanted to share his father's story to make sure people realize how dangerous the coronavirus is, as well as to make sure that his dad, like all of the people that we're talking about, aren't just a number that I read off every night. That we don't become numb to this loss or to the number of cases. And that knowing a name, a face, a family, a hero ought to help us be more committed every day to doing the right thing and following those restrictions and that guidance. Let's make sure that our need to have somebody else over to our house or to go to a mass gathering doesn't result in us losing a hero like William. I want to thank Chad Hedrick from WSAZ for reporting on this one. And let's all remember how special that William is and was, as well as everybody else that we've lost. I want to give a brief update on some of our areas of concern that we talked about yesterday. The first is long-term care facilities. So this is our update. We have had 17 additional residents test positive in our nursing homes since yesterday, 13 more staff. We've had 2 more resident deaths, and our number of facilities impacted has gone up by 4 to now 25. But I do want to mention that for a minute. While we say 25 facilities, at least 10 of them haven't had residents test positive, have only had staff members. And in many of those staff members weren't necessarily in the facility or even around the facility during that period of time. This is an area we're working really hard in. And Dr. Stack's been working directly with several in the last couple days, and a lot of his job, I know, is changing to helping in situations like this, clusters and outbreaks. And I show this every day, not just to be transparent, because this is what this virus does. And it's doing it everywhere across America. But hopefully reinforcing that the most vulnerable are hit by this, and let's make sure that we are all doing our part. Give an update on Green River. This is a correctional facility. We now have just 1 additional case, and that is of a staff member. But we are very fortunate, at least today, that we haven't had another inmate test positive. No, people are working very hard at Green River to do everything they can in that facility. Now let's go to Western State Hospital. Western State has been hit really hard. We don't have new residents that have tested positive today, but we have 3 additional staff members, and today's reports included 2 deaths from Western State. It is a situation where, again, it shows what happens and how this can spread, especially in vulnerable populations. And our job is to do everything we can to mitigate this in the facilities themselves. But again, also a reminder on how this can spread and where that death toll can really increase if we're not doing what we need to do every day. And my goal, folks, is to give you the most transparent facts that we can every day. And that's not just on areas where we think we're having success, but areas that we want to do a lot better on. There are no new folks coming into Western State. Our heart goes out to what's going on in that facility right now. Please know that we are working directly with that facility. Our Cabinet Secretary, Eric Freelander, is directly involved, and we are going to do everything that we can. All right, so with that, we're going to move to questions. We have folks here, and we have some questions that folks have sent in. We'll go back and forth between them. All right, first one I have here is about Trayton Oaks Tower in Louisville. And it's a question of what's being done to address what's going on there. What we have in our numbers are now 18 residents have tested positive and 5 staff members. We also believe that there have been 3 deaths in the facility. And so to everyone that is there or who have a family member there, we are thinking about you. We know it's a scary situation. We know both the local health department and others are working very hard to address the situation. This is a senior living facility, and there have now been an allocation of more than 100 tests for those that are there and who are working there. A CDC expert was sent there today to talk about PPE, and we're working with them, and I know the local health department is working directly with them as well. I was asked about construction of the field hospital at the state fairgrounds. Beds have been ordered. Other things are on order. We hope our first 250 beds will be available within a couple of weeks. Joe.
When adjusted for population, it looks like Western Kentucky has some of the highest in the entire state. Hopkins County, Muhlenberg County, Davis County, they have many more new cases today. Is this community spread in that region the most concern for you right now in the whole state?
So the question is, when you adjust by population, there are certainly areas of Western Kentucky. Hopkins County has been hit particularly hard. Davis County, which has a bigger population, but still hit pretty hard. Muhlenberg County, a lot of Muhlenberg County, or part of Muhlenberg County, is Green River, which we talk about. And is that one of our major areas of concern? Everywhere that we have a cluster, and that's what we would call this, is of significant concern. Much of the cluster can be traced to specific events or areas within it, and so trying to push resources to those areas to try to at least reduce the spread. Yes, it's a great concern to me. We do have great local leaders who are even taking extra steps above and beyond what we've done statewide. Hopkins County Judge Executive, Madisonville Mayor, and others, I believe, have initiated a curfew, as has Curtis McGee, the Muhlenberg County Judge Executive. Additional restrictions on drive-up church services in Hopkins County, given what they are facing. So yes, any area, just like when we started Harrison County, is of concern. That's also how this works and how it spreads and how it can very quickly move out in a community. And it's important to know this can happen in any community. And especially now when the coronavirus is in just about every single state, a single mass gathering that's held right now, pick your county, can blow up like we have seen in some of these areas. Question about taking a call from a home health care nurse. She says they're not being provided N95 masks, some only having surgical masks. Why are healthcare providers not getting proper gear? The answer is that there is a severe shortage of personal protective equipment in America. In every state, in every region, there is not enough. We are working every day. We are hoping to have some success here in the near future of securing more and being able to push that out. It does show how so many people are showing up and doing something truly heroic, knowing that in other circumstances, without a worldwide pandemic, that there would have been more protection. Now, our healthcare workers don't have enough PPE. They don't. They absolutely do not, and it is unacceptable, and we're doing everything we can to fix it. And as we fix it, let's understand that if we're there waiting in line and we are anxious and nervous and we're scared if we're at a healthcare facility right now waiting in line, what those heroes are doing and what they are sacrificing.
In regards to church services, do you anticipate any action needing to be taken by the state, either police enforcement, National Guard even, or anything to keep crowds from gathering at churches either this weekend or even this week?
The question is on churches or any mass gathering during this week about do we see taking any additional action like state police or National Guard with them. We've now identified that there are probably, because there's been some work done in the last 24 hours, around 17 or less churches or other entities that are claiming or their reports are, and so you got to take that with the reliability that comes with it, that still might be holding mass gathering. First, let me say, for a state of 120 counties, 4.5 million people, and the number of houses of worship we have, that means just about everybody's doing the right thing, making the sacrifice. For those that aren't, we are working with the local officials right now to do everything we can to prevent them from happening. Because if you get 50, 100, 200 people in one building, whether it's for a service or anything else, the coronavirus will spread. And we have seen examples. We have scientific evidence and definitive facts that show that these types of services have spread the coronavirus to dozens upon dozens of cases, and that there have been deaths that have resulted from it. So, if you are the leader of a congregation, if you are charged with protecting your flock, don't do something that will mean that there are fewer people at Christmas than the service you want to put on now because they have died. And so we'll be taking additional steps, and those that want to openly claim that they're still going to be doing these things, knowing they're going to put people in harm's way, can probably expect to see us. Now, our hope is that we can still convince everybody to do the right thing. And let me just again say, my church is as important to me as anything. It is a regular part of our lives. Tonight, my kids will be rehearsing with their children's choir. My son was supposed to be baptized on Sunday. It is important to me, but I know we are doing the right thing. It's not just a matter of wisdom, which God gives to us. My faith tells me that we have to protect those around us. Reports today about movement of people in Wuhan, China, after a 76-day lockdown. With continued social distancing, could we hope to be freely moving about in Kentucky by Memorial Day? We're going to need more info to know how long this is going to take and what type of restrictions would be in place. But let me just draw a couple of distinctions between us and Wuhan, China. So Wuhan, China had the spike. They had the spike that is Philadelphia, but on a much different level. And they are also a part of a country that has an authoritarian government where they can lock everybody in their house and only allow you to go out for a certain period of time every day to do one thing and probably monitor everybody that's doing it. There is no direct comparison that we can make between us and that part of China. We are doing our own thing. We are doing it better. Our use of social distancing is flattening the curve, but it means our experience is going to be different. It is going to take as long as it's going to take. And that doesn't mean we're talking about years, we're talking about months. I can't tell you exactly how many because we don't have all that data. But no, with all the other generations that have made sacrifices, most of them didn't know how long it would take or if they were going to win. We know that it's not indefinite and we're going to win.
I'd like to ask both you and Dr. Stack about the antibody test. Do you know of any commercial labs that you're working with that have sought FDA approval for the emergency authorization to get that antibody test? And also, based on what you've learned, do you think that could be a potential game changer?
I can say from my end, we don't have, at least I haven't seen enough scientific research to suggest that any of these antibody tests will be a game changer. Now, I like that they're doing it. I know we've got at least one Kentucky company that is participating and hoping to get approved for clinical trials. Everybody that's out there that thinks that they might have a medication or a solution, keep pushing. But I don't believe in false hope. And I want to make sure that I have information suggesting something is going to work before I endorse it. Now, I do endorse everybody trying. And I want people to be innovative and to look for that next thing. Dr. Stack?
Thank you, Governor. So I'm going to use this as an example. My mom watches these from home in Ohio. So she pointed out when I answered this question about antibody tests the other day, I didn't explain IgM and IgG, and I did that on purpose. Usually I try to be as clear as I can, and I wanted to be unclear there to make sure, this is kind of complicated. So there are immunoassays that test for your immune response to the disease. And there's different kind of antibodies. There's ones you make right when you get infected, and there's ones you make that are later after you've recovered from the infection that may protect you over time. Right now, the typical person trying to determine is some immunoassay they're being offered. There's some that blur multiple coronaviruses. So coronaviruses also cause the common cold, and they're not bad like this one is. And so if you get the wrong test, some of them blur IgM and IgG, so you don't know if you just got infected or if you got infected before and now you're immune. And some of them blur multiple different diseases. So if you get the wrong test, you've just wasted your money. So done in a hospital setting or with physicians who are skilled in understanding what a specific test is testing for and what it's useful for, the test could be very helpful. But this is a very new infection, and those tests are still evolving. And so right now, I would really strongly recommend people don't go seek those things out. And if you're in a hospital that has the kind of qualified healthcare professionals who know how to use those, yes, over time, in the months that come, those could be very helpful. But right now, we're not there yet, and it's too early for people to look to that for a solution.
That was a really scientific way of saying we don't know yet. He did it better than I did, though. Here's one. This is from WRIL in Pineville. I've had several listeners asking about their employers not allowing them to use PPE at work, saying it's not professional or it will scare customers away. If you are at a work that puts you in proximity with people, you should be allowed to, in the very least, wear that cloth mask. I mean, that's now being recommended when you go to the grocery store. Now, don't wear an N95 mask if you are not a healthcare worker, because that healthcare worker needs it a lot more than you do. But any employer that is suggesting that you don't wear this or gloves if you have them, if you have the nitro medical grade or even industrial grade gloves, we need those. Wear a different pair if you can. Anybody suggesting that you shouldn't do that, folks, we got to do better than that, or as I normally say, we can't be doing that. Can we show the number for donating PPE? Yeah, we're moving fast today, but remember, personal protective equipment is so scarce in this country right now. We work every day on trying to buy it. It is the most frustrating thing that I've tried to do, I think, in my entire career, and it's more important now than anything I've ever done in my entire career. This is what we spend our time on doing. We're also working on the manufacturing side, and we're having some real luck with some companies that are able to do some of these things, face shields being one of the best that folks have been able to do. But the number one way we're getting additional PPE are by donations. And I know there is still more that's out there. We've had a couple of large donations recently. So if you still have PPE, it is needed in your state. Phil.
Can you talk a little bit more about that $600? Is that going to be for everybody who's filed unemployment or just certain people?
The question is about the additional $600 for unemployment, and this would be the day I don't have Josh Benton here. I believe that the $600 is a supplement to everybody who qualifies for unemployment, but we'll get Josh to answer that. I was literally handed the email as I was up here, and it is good news, but we'll have to have clarification of that tomorrow. And at least this email says we have confirmation that payments may start as early as tomorrow evening. So we will get Josh here tomorrow to break that down. I understand that House Bill 351 has passed the legislature and is on my desk. Can you offer any guidance on whether I intend to sign it and how I might approach expanded voting by mail if I sign it? Voting by mail is something, I had a meeting on it today with my staff. It's something that I believe for the primary we have to not only be looking very seriously at, but we got to be moving forward with the plans for it. That doesn't mean that that's what will happen in November, though if it is necessary, if we have a fall spike, it would be good to have a test run in a primary with the importance especially of a general. I was shown some initial projections on what it might cost the state, and I'm absolutely willing to do it. This is an area where I can't ask poll workers, especially when our poll workers are in typically the most vulnerable population to the coronavirus, to be in that facility with people coming in and out and in and out. If we still have concerns about this, and June 23rd, well, I hope that we are on that downward curve. When we are able to start releasing some of these restrictions, the people we're going to need to protect the most are the people that are the most vulnerable. You know, even when at some point in the future we're able to start opening these up, we'll need to be very careful about our vulnerable population over 60 or in that risk group of heart, kidney, or lung disease of still being healthy at home. And so it's going to be a real challenge where we're going to have even more buy-in, and it's going to seem unfair to a lot of people when we're at the point where we can slowly start easing those restrictions. Joe.
I have a follow-up on the church services this weekend. You said that you're working with local officials on those 17 or so that are still planning to have services. If they do have services, do you want local officials to block or prevent those, or is that up to each law enforcement agency to do what they want to do?
The question is, with working with local officials on those that might still hold mass gathering services, other things this coming weekend, what do I want to see them do, or what would we be doing? At this point, I still hope that we can convince people not to hold them. If it takes a sheriff or a sheriff's deputy being in the parking lot, telling people as they go in the risk that they face, which is an absolute spread of the coronavirus, that one I don't think is questionable at all, and the potential for death not only within that congregation but outside of it as you look at the experience that we've seen. My hope is that step would be enough, but I'll consider other steps beyond that if we have to. I'm not going to, I can't allow for somebody thinking that they should be the exception when everybody else is doing the right thing, to put people who come thinking it's a test of faith in harm's way. You know, it's if I was in a world 4 months ago, everybody would say that I'm crazy, but I'm just willing to do what it takes to save people's lives, and that's now how I judge how I do my job every day. Do I think we saved lives or not? It's not how I thought I'd be judging myself as governor, but that's where we are. And let me say, we held a call with all the county judges in the counties that we think there might be services, and to a person, they were ready to do what it took. It was really special. And that was people at different political parties and different regions. I was really proud of them. And there's just absolute unity knowing that we're doing the right thing to protect people. What do we see before some of the social distancing measures are lifted? Decrease in new cases per day, et cetera. So what we will need to see is that we have reached the peak and that we are coming down, and that we are coming down significantly. Then we have to look at the options of which restrictions we can release at what time and to what degree. It won't be an all in one day because we would spike right back up. Then we really need to think about the populations that would expose to more contacts that are out there. Because at least theoretically, when cases are starting to significantly come down, our healthier portion of the population that this disease and virus infects, but doesn't cause substantial harm to, is one piece. But then there's those that are the most vulnerable. So what I believe we will see, and people should expect, is we will have a multi-tiered step down when we are able to do it on both types of restrictions and potentially areas, but also groups of people themselves. And I hope people will bear with me with it. It'll be hard, but it'll be necessary to make sure that we can, in terminology that I would use, peter out this disease as we get it down while protecting people from harm.
A couple of people have been calling our station saying that they've received double unemployment payments. They don't know what to do about it. They should return it or keep it. I'm not sure. This may be a small sample size.
So the question is, there have been some people that have called a station saying they've gotten double unemployment payments. They need to call us. We all are entitled to what we're entitled to under it, and somebody else needs those funds. But that means that people are getting their unemployment payments, which we are trying to do every single day. And folks, there's absolutely going to be mistakes on both sides of payment or non-payment. There are going to be, and we'll do everything we can to address them. But these are unprecedented times. Phil?
Do you have any information about the, I guess it was, hang on just a second here, I'm going through the text message here. Toyota's talked about transitioning from making vehicles to making PPE. Have you been in conversation with them about how that's going?
The question is Toyota being in conversations in manufacturing some PPE. We are directly in talks with Toyota. Let me say that from what they've done in their facility to their donations of PPE to looking at the potential to manufacture and engineer some, in fact, here in Kentucky, they've been really responsive and responsible, and we appreciate their approach. We're talking to them directly, trying to see what they can do, especially at the top end of the PPE that we need. Is there any more information on plans to use Our Lady at Bellefonte in eastern Kentucky? We don't have an update on that now. As the surge continues, that'll be when we have the opportunity to get there. Other Joe, one last one.
In regards to drive-in church services, I know we've kind of talked about that a little bit. It seemed like there was some tension about whether Louisville is allowing that or not. But what recommendations do you have about that as a possibility to still have services for Easter?
So the question is on drive-in services. Now, this is something that while if people follow the rules, that we believe is okay, where our local leaders for the situation they have on the ground believe that we shouldn't have them, I fully support them. So I fully support Mayor Fisher. I fully support our county judge executive in Hopkins County, where in their counties there are good reasons, whether it's population density or the specific outbreak that we have seen in Hopkins County, where they shouldn't be done. For all others, again, We can do these, but only if we follow the rules. And if the rules aren't followed, you're not protecting people, which is the whole reason that we're trying to do this. So, only one family in a car. If a whole bunch of families or friends get in one car, they're spreading the coronavirus. Cars have to be 6 feet apart. They can't be on top of each other. Nobody can get out of the vehicle. It's really important. We've seen some different things that all have, good intentions, and people are jumping out or getting in lawn chairs or hugging on each other. We can't do that. Let's make sure that we follow those rules, and then we shouldn't be passing anything inside and outside the car. I know that's hard. Communion's very important on Easter or our other traditions, regardless of our faith. But if we follow those rules, we believe that people can be protected pretty well, and that's a chance to still have some proximity to each other. Now, we've run long, but I wanted to end tonight with another individual we've lost to the coronavirus. And though while he wasn't a native Kentuckian, his dad was, and he certainly wrote some of the best songs about our state. John Prine was a singer-songwriter who grew up in Illinois, but his family was from Muhlenberg County. He is well known here for that song that he wrote about his father's hometown of Paradise, Kentucky, titled Paradise. So many Kentuckians appreciate his musical talents, as did the Recording Academy. He was a recipient of 2 Grammys. Sadly, he passed away yesterday after being hospitalized with symptoms related to COVID-19. He was 73. Tonight, we pay tribute to him and to all Kentuckians that we have lost by playing his music, a recording of My Old Kentucky Home, accompanied by photos from those who have lit their homes and or buildings green to honor all that we have lost. And his family, his group, not only approved, but we're excited that his music, the day after we lost him, would be playing in one of his favorite places on earth, Kentucky. Thank y'all. See you at 5.
Oh, the sun shines bright on my old Kentucky home. 'Tis summer, the old folks are gay. Well, the corn top's ripe and the meadows in the bloom, while the birds make music all the day. Weep no more, my lady, or weep no more today. We sing one song for my old Kentucky home, for my old Kentucky home far away. Where the young folks roll all around the cabin floor, they're merry, all happy and bright. By and by hard times will come knocking at my door, then my old Kentucky home, good night. Weep no more, my lady, nor weep no more today. We sing one song for my old Kentucky home, for my old Kentucky home far away. Kentucky home, for my old Kentucky home far away. For my old Kentucky home far away.
Thank you. Thank you all for being here. I appreciate you taking out time in your morning, and I'll try to make this worth your while. I wish that staff and strep and E. coli would just take a break for a couple months while we deal with this, but alas, we have to do everything all at once. I'm going to talk about the new SARS coronavirus. That is the official name, Severe Acute Respiratory Syndrome Coronavirus 2, and that is the virus that causes COVID-19 that you've heard of, which is Coronavirus Disease 2019. So SARS-CoV-2 causes COVID-19, and throughout this talk I'm going to call it SARS-CoV-2. It's been in 75,000 people now, and about 1,000 of whom have been outside of China, and about over 500 of those have been on a cruise ship off the coast of Japan. So because most of it is still in China, the World Health Organization has called it an epidemic, but we all know it has potential to be a pandemic, but they haven't called it that because we know what happens if you call it a pandemic. I don't have any disclosures. I'll jump right into the first case. On December 20th, 61-year-old man had a fever and cough for a week, then presented with worsening symptoms. Respiratory distress developed after 7 days in the hospital and worsened further over the ensuing 2 days, necessitating mechanical intubation and ventilation. He had been to a seafood wholesale market where live and dead animals are sold. A chest x-ray at the time of intubation was obtained. We have 8 days into the hospitalization, and even at 11 days, the ARDS is even worse. Now we'll jump to case number 2. January 19th, 2020, 35-year-old man presented to an urgent care clinic in Snohomish County, Washington, with a 4-day history of cough and subjective fever. On checking into the clinic, and you can imagine this is your clinic, the patient put on a mask in the waiting room. After waiting approximately 20 minutes, he was taken into an examination room and underwent evaluation by a provider. He disclosed that he had returned to Washington State on January 15th after traveling to visit family in Wuhan, China. The patient stated that he had seen a health alert from the CDC about the novel coronavirus outbreak in China, and because of his symptoms and recent travel, decided to see a healthcare provider. His chest x-ray was read as normal at that time. He was examined and tested for rapid flu A and B, which were negative. It was also sent for a full respiratory viral panel. Washington State Health Department was called and clarified that he had not been to the seafood market or around someone who was sick. He was designated as a person under investigation, PUI, and a novel coronavirus, SARS-CoV-2 test was obtained. He was sent home to be in isolation. 2 days later, the viral PCR panel was negative, which includes endemic coronavirus. But the SARS-CoV-2 test that the CDC did was positive, and he was admitted. He was given supportive care. White blood cell count was 3.9, fibrinogen 477, and the procalcitonin was normal. His chest x-ray at the time of admission, and you might see a faint infiltrate there in the left lower lobe. And this was his hospital course, and what you see is he came from China halfway around the world and went to work the next day. This is a high-caliber individual. And then the next day he had a fever. Next day he still had his fever, and he stayed at home, and then he presented to the urgent care that I just went over. So he kept his fever for about a week. His cough was longer than that. He had a little bit of runny nose, Fatigue was most of the time, and then there were some scattered GI symptoms throughout his course. So here's the outline I'm going to go over today. And first, we'll overview coronavirus and the outbreak. Coronavirus belongs to the family Coronaviridae, and there are 4 genera: alpha, beta, gamma, delta. Humans can get the first 2, but animals can get all 4. The anatomy is quite simple. There's a single-stranded reverse sense RNA. It's surrounded by a membrane, and then you have these spike proteins on the outside, which you can see on electron micrograph here, that gives coronavirus its name, corona meaning crown in Latin. This is coronavirus on a human cell, and those spikes help it attach to human cells. So coronavirus starts in some type of animal, usually a bat or a rodent, and then if it infects humans, it's through an intermediary host, such as a camel or a cow or a civet cat, and then gets to a human. So what this slide outlines is that some of what we've forgotten is that there's 4 types of endemic coronavirus that we see every year, even in Louisville. And they have these letters and numbers. And then there are 2, now 3 serious coronaviruses: SARS that we had in 2002, 2003, that we had a grand rounds on back then, MERS, and now SARS-CoV-2. So the alpha coronavirus was the first one discovered in 1966, quite a long time ago, the HCoV-229E, and it was followed up closely with a beta coronavirus, OC43, in 1967, and then we didn't hear any more discoveries of coronavirus until that SARS outbreak in 2002. At that time, it stirred up some research, and a couple other endemic coronaviruses were discovered. And then it was another decade, and we had the MERS coronavirus, and now we have SARS-CoV-2. SARS, the original SARS, severe acute respiratory syndrome, infected over 8,000 people, killed over 700, and had a mortality rate of about 10%. It infected people in 26 countries, which, ironically enough, is about how many countries people have been infected with the new SARS coronavirus, but there were 2 exceptions. There was 1 case in Colombia where we have not had a SARS-CoV-2 outbreak, and we haven't had any in South Africa, although we had 1 in Egypt. Then MERS, Middle East Respiratory Syndrome, is in 27 countries, and it's, near the Middle East. There were 2,500 cases, about 850 deaths, with a much higher mortality rate, 35%. So you see, he's going to get the coronavirus, but she probably will too. The endemic coronaviruses are 229E, OC43, then NL63, and HKU1. And we've been taught that it's just the common cold. But we have questions about that. Is it really just a common cold? How does endemic coronavirus, since we're not so familiar with it, compare to something we're more familiar with, like the flu? And what about this endemic coronavirus? How does it compare to the new SARS-2 virus? And so Dr. Ramirez said if the Chinese can build a hospital in a week, we can publish 2 papers in a week. So let's